So, do you need strep antibodies or a positive throat culture to diagnose pandas? So, this is a common question that parents have, and it's a common question that other clinicians, physicians have that I'm asked. But the most common way I across this question or comment is that I will see children come into our practice when they've seen someone else who's not as familiar with pandas, and they've parents have brought something up and said, "Hey, listen, my child had a sore throat or an upper respiratory illness," and then they develop this sudden onset severe OCD, anxiety, aggression, defiance, etc., maybe some facial tics, and they go in to see their provider, and the provider, if they acknowledge pandas, hopefully everyone does at this point, they will do a throat culture and or strep antibodies blood test. And often, when these come back negative or normal, parents are told, well, it can't be pandas because you don't have a positive strep test. And so I wanted to, talk about that for a moment because that's actually a misunderstanding of pandas in general. So, first of all, pandas is very similar in the way it acts and actually the etiology or the cause to rheumatic fever. So, rheumatic fever is an autoimmune condition that occurs after you get a strep infection. And so, people, when they get rheumatic fever, can have heart involvement, they can have skin rashes, joint pain, and swelling. And they can also get Sydenham-Chorea, which is a movement disorder. And so, rheumatic fever can be damaging to the heart and can cause some problems. It's one of the reasons people test for strep and treat strep. But what's interesting about rheumatic fever is that rheumatic fever, which has many of the same autoimmune markers that PANDAS does, is that rheumatic fever can occur weeks to months after the infection. So, there are times when I will see people and they've had an onset of PANDAS symptoms, and parents will say, actually, they weren't sick at the time. And so there's two reasons this could happen. You could be seeing a delayed presentation of the clinical, condition, PANDAS, sometime after they've been sick. And the other thing is this. So PANDAS is two things. People tend to think of it as an autoimmune condition where the immune system, rather than just attacking infection, attacks the brain. But what I will tell you is that there's also in these children an element of immune deficiency. Often, not always, but often, they tend to get sicker more often than other people. And the other interesting finding that I will hear from parents is my child had a behavioral change, but they had no fever, no sore throat, they weren't no stuffy nose. And they ended up getting tested and sure enough had strep at that time. And so, what that's an indication of is a type of immune dysfunction or immune deficiency. And here's why. So, when you get a fever or a sore throat or any of those things when you're sick, that's not caused by the bacteria or the virus, it's caused by your own immune system. So, when you get a fever, your immune system is turning up the heat to try and fry the bacteria or the virus and get rid of it in easy to understand terms. And so when you get sick and don't have a fever, it can be an indication of immune deficiency. In my 30 years in the ER, I used to see this in elderly people who were immune compromised. They would come into the hospital and have a ruptured appendix or have a huge urinary tract infection or pneumonia, and they really wouldn't have a lot of those symptoms. And a lot of times they would have no fever with any of these big infections. Often the only thing you would see was a mental status change or confusion or inability to walk, weakness type of thing. So, because of that, when you see a behavioral change like this, it's important to test and to know where to go from there. The other thing about this is this: if you have a child come in with sudden onset severe OCD, anxiety, aggression, insomnia, motor tics, and things like that, and you test for strep and it's negative, the other thing you have to consider is that we also see these very same findings from other infections. In that case, we call it PANS, pediatric acute onset neuropsychiatric syndrome. So we can see it from influenza or Mycoplasma. Actually, the winter of 2024, I had several patients come into our office after having influenza A for whatever reason, had their first episode of PANS after having influenza A. It's not anything I've really seen previously in the last 13 years that I've been treating children with PANS and PANDAS. So I think it's important to understand if you've brought a concern to your provider and they've tested and said, can't be PANDAS because the strep testing is negative. Just understand that's just not an understanding. In fact, when we diagnose PANS and PANDAS, it's based all on clinical findings. And so there's a list of clinical findings. So I hope you found this helpful. I hope it's improved your understanding. And I would direct you to go to www.thepandasdocs.com, and there you'll find tons of free information, blogs. You'll also find a link to get my book, The Comprehensive Physician's Guide to PANS and PANDAS, to the management of PANS and PANDAS. And that is there. It's cheaper there than on Amazon. You'll also find a parent course that we have there that you can pick up as well. You can also find us on Facebook at the Pandas Docs and Instagram at the Pandas Docs. Hope to see you soon. Take care.